Of all of the criticisms with Obamacare, what is the number one? To me, it has to be higher premiums.
I think that absolutely is. Maybe a close second is that this law is pushing people out of their current health insurance. Maybe third is that it's busting people down from full-time to part-time jobs and eliminating some jobs for people entirely. But as far as the healthcare sector is concerned, the biggest question mark is whether the subsidies that this law promises are actually going to be available. You've got as many as half of the states saying they're not going to participate in the Medicaid expansion, or they're sitting on the fence. And you've got litigation that's moving through federal courts right now that could prevent the disbursement, the issuance of subsidies through 2/3 of the health insurance exchanges in this country, because actually that's what the law says. Because they're federal exchanges, there are no subsidies. So that's going to the healthcare sector is paying very close attention to that, and the uncertainty about all of that money has got to be affecting their stock prices.
Michael, great setup there for the criticism. David, over to you. You were there when President Obama implemented this reform. The criticism is certainly heating up, and that is, how are we going to pay for it? Are consumers going to have to pay higher insurance premiums?
Well, first of all, the vast majority of people in this country get coverage currently through their employer, through Medicare and Medicaid. You're talking about a small percentage that are going to go into the marketplaces that open in October. Let's talk about, by the way, already. You've already had over 70 million Americans enjoy preventive care services, which brings health care costs down. Health care costs have been moderating. You've got over 100 million Americans now not subject to lifetime caps. So there's a lot of good things happening. Implementation is obviously going to be a very complex endeavor. And I'd say right now there's an interesting dynamic where you see conservatives now wanting to re-engage on the debate about Obamacare. Maybe because it was so successful for them in 2010, they want to go back to that playbook. The American people have moved on. They were clear about this in the last election. So what they want us to do is implement it, make adjustments, and there's no doubt through the implementation process, you're going to find things that need to be fixed, need to be adjusted.
It's not a very popular law.
Well, what I'd say is, by the way, amongst seniors who are getting prescription drug relief, amongst young women in particular, amongst Latinos, growth areas of the electorate and of the country, it's actually become more and more popular.
If you look at Aetna's chart, Michael Cannon, it's to the moon. The healthcare stocks are just to the moon. I want you to state, as a dyed-in-the-wool Cato Institute George Mason type, who exactly is getting crushed by Obamacare? I see the stocks up. Isn't that a good thing?
Well, no, because they're up. The reason they're up is because of Obamacare's crony capitalism. David was there. He knows that the way they got the industry on board was by showering the industry with subsidies. And that's what Obamacare is doing to health insurance industry stocks. It's what it's doing to hospital stocks. It's what it's doing to all corners of the healthcare sector.
Great.
Except that this law is so unpopular that states have been refusing to participate, and that is threatening the subsidies.
Who is the loser? Who is the loser of where we're going in healthcare?
Well, consumers, employers, and most of all the sick, because Obamacare is going to crush innovation in healthcare and healthcare delivery, so that we're all trapped in the same sort of 1960 style of healthcare delivery that Medicare has frozen in place.
David, also businesses could get crushed on this, because now there's a mandate where if they have 50 or more full-time workers, they have to provide insurance, and that means they would just not hire full-time workers anymore.
Well, I think if you talk to most employers, they're not going to make that judgment. Obviously, the subsidies, not crony capitalism. These are tax credits to small businesses, to working people, to allow them to get health care. And why did the insurance companies support it up in the first place? Because more people are going to come into the insurance marketplace.